Good day, global citizens. Welcome to another episode of Dr. Fajembola'S Opinion. Today we have a good colleague of mine who is one of the authors. I was specific about having a female on this episode to balance the number of male and female guest researchers I bring on board. Today we are looking at the association of over-the-counter nospamin and grape water use with spontaneous intestinal perforation in neonates. A case series. Dr. Kawthar Ahmed, it's nice discussing with you on this platform. How are you doing today?
I'm doing fine. How are you too? I'm glad to be here.
I'm good, oh, thanks to God. Today we are looking at the publication which you are an author on a retrospective case series describing 5 units who presented with intestinal perforation following exposure to nospamin and or grape water. All cases were managed in a medical institution where you worked in, which is the University of Ilorin, over a 12-month period. The neonates with an average age of 8.4 days at presentation showed abdominal distension, fever, feeding refusal, imaging confirmed intestinal perforation in all cases. 3 units out of the 5 underwent successful perforation repair. 1 unit improved with conservative management, while another succumbed to hepatic failure and multiple organ dysfunction syndrome. This is very interesting because when I came across the paper, being a mother, it caught my attention. But before we go to the question, I know our audience would like to know the profile of Dr. Ahmed Kawthar. So let me give you the bio of our guest researcher. Dr. Kawthar Omolola Ahmed is a Nigerian medical doctor and biomedical scientist with a growing interest in pediatric surgery. She earned a Bachelor of Medicine and Bachelor of Surgery with distinction from Makerere University in Uganda, and also holds a Bachelor of Science in Biomedical Science. She went on to complete a medical internship at the University of Ilorin Teaching Hospital in Nigeria. Alongside her studies and clinical training, Dr. Kawthar has been actively involved in student associations, research societies, and health advocacy initiatives. She has participated in leadership and mentorship roles, as well as community health awareness projects, which have shaped her values of service, collaboration, and continuous learning. So beautiful profile. Thanks for accepting my invitation, Dr. Ahmed. So let's get into the discussion for today. You know how we do it on this platform. Usually before I start asking questions, I try to get, because we are trying to make this publication something that is easily understood by the layman. So what are people saying? Grape water, actually, I've never used grape water for my children, but I try to get tweets about what people are saying about grape water across the world. Not specific to Nigeria, because grape water is used everywhere. The first I got was from Shola Ad, where she said, from birth to 6 months or even more, your baby should take only breast milk. No water, no juice, no soda, no grape water. Breast milk already contains the perfect water content, temperature, nutrient, antibodies, and beneficial bacteria. Then the next tweet from Ware, where he said, in Pakistan, Woodward's grape water was commonly given to children for stomach pain. When our children were young, their grandmother bought it for them from Pakistan. When we showed it to the children's doctor here, she got very upset and said it absolutely should not be given to children. So I guess this is a case of a grandmother being very caring and coming with omugo material for the grape water. So the last tweet is from Olamide Obe, where he said, except for Guinness Stout with 7.5% alcohol content, most top-selling beers in Nigeria are less than 5.5%. Smirnoff 5.5, Gouda 5.2, Star 5.2, Up 5.1, Heineken 5.0. But that stuff called grape water given to babies as a 4.4% alcohol. Oh my, whose idea was this? Okay, grape water has been used across generation, whether it's and it has been working for babies. So whether it's a good idea or a bad idea, we'll know from our discussion with Dr. Kawthar today. So the first question, let's dive into the question as we get more insight into the publication.
Okay.
The first question is, what spiked your interest in pediatrics? Because I've known you, Dr. Kawthar, as an excellent doctor, and you're interested in pediatrics. I will assume maybe you go for neurosurgery or cardiology. What sparked your interest?
Wow.
Because as a mother, I already have enough headache with children at home. For someone like me, I don't even pediatrics. So, what sparked the interest in pediatrics and more specifically pediatric surgery?
Okay, that's a good question that a lot of people ask me. So I'm going to answer it in two parts, which is the pediatrics bit and the pediatric surgery bit. So for pediatrics, naturally, I'm just drawn to the pediatrics age group. So while growing up, I had like a very strong sense of connection with the pediatrics age group. You know how Nigerian parents will tell you, go stay with someone and help them with their baby and all of that. So I was that child they would give out like, okay, she likes kids, let her go, right? So from then I already had like a strong sense of connection, and I also have empathy for them, which really made caring for pediatrics age group very easy for me and rewarding, I would say. Yeah. So for pediatric surgery, right? So there is like a small story behind that. So during my clinical year, while I was studying, right? I was in my anesthesia rotation, and I went for the first time I went there for my anesthesia rotation, right? And it was a surgery on a pediatrics child. Yeah. I mean on a child. So the whole time I went to observe the surgery, and I literally forgot that I was there for anesthesia. And during that moment, it just clicked to me like I just saw the whole procedure, and to me it was like this is a surgical intervention that is dramatically changing a child's life, and also more like it gives hope to their families as well. So at the end of the day, and now looking back and reflecting again, pediatrics age group are the age groups where they easily heal because of their physiology. So it's a bit rewarding seeing how fast they can heal. They pull through a lot of things, right? And also at the end of the day, I would see it in all. I see it as if I'm not only having a positive influence on the child's immediate health, but also their long-term well-being and also their growth. Yeah. I hope that was not too long.
No, it's not at all. It's quite beautiful to see how I developed interest in pediatric surgery.
Yeah.
Actually, as many physicians, they develop interest in different fields. Some in medical school, some postgraduate, some they even have to practice for a while before finding where they want to belong to, which is very fine. Dr. Kelsey, you've experienced, I know we've both, but I feel you have more experience. You've experienced the health systems in Uganda. You got your undergraduate degree from Uganda. You experienced the health systems in Uganda and also in Nigeria. What can you say about your experience in dual health sectors?
Oh, okay. That's a great question that I get asked all the time when I was doing my internship. So I always say there are three distinct things that I see in the health system that I always compare with each other. So the first thing is looking at the referral system, okay? In Uganda, there is a more structured referral system. So it's a bit organized from the healthcare system, the healthcare level 1, it's in tiers, right? 2, 3, 4, and then you move to general referral hospitals and then national referral hospital. So I feel like there is like a clear path of how patients access care and specialized care, all right. But in Nigeria, it's less strict, right? It's less strict, strictly enforced. So you just see like a patient out of the blue at a tertiary hospital, right? And you wonder why is a malaria case that is not severe malaria, it's just a simple malaria. Why are they presenting at a tertiary hospital? Yeah. So that's the first one. And of course, that gives you a really huge workload. Yeah, which makes working hard at the end of the day. Then the second one is I would look at the workforce, the distribution and the training. So in as much as both countries are facing a huge, huge, huge shortage in healthcare workers, now, for Nigeria, we have more like an urban centralization of doctors, right? So
Yeah.
it's to some extent, it leaves the rural community underserved to some extent, right? So, but in Uganda, there's a task shifting. You'd see like at the healthcare centers, you would see a clinical officer, you see a nurse, you would not necessarily see, obviously, a specialist there. Yeah, so I think also the workforce distribution is different, if I may say. Then the third one would be the health finances, right? So when we look at Nigerian health financing, it's majorly dependent on out of pockets, right? Now, this accounts for most of the population, they pay out of pocket. But if you look at Uganda, it's also out of pocket to some, of course it is out of pocket, right? But it's not as common as it is. And the government provide free services in healthcare at the public facilities, right? But it's the opposite in Nigeria. Of course, in Nigeria, some group of people, which is not it's literally the minority, they can access the NHIS, right? Yeah.
Yeah.
So those are my three go-to comparison each time I want to talk about it.
Thank you so much for that beautiful answer, Dr. Kawthar.
You're
I
welcome.
feel the audience will have a full scope of the dual health systems you've just explained. On grip water now, let's dive into the discussion deeper. Grip water. Aspect here. Yeah. So grip water as combination, and you've seen from earlier one of the tweets we covered where someone is lamenting like grip water as 4.4% alcohol, like from what that person was saying. Why do you feel it's considered as a herbal medication?
So grip water is considered as a herbal medication because the primary components are derived from medicinal plants like I think it has ginger, peppermint, chamomile, sodium bicarb. Then the alcohol bit of it, some of it is written, it has alcohol, and some of it it's not written on the brand. So also now it's also classified in some countries, the regulatory bodies classify it as herbal medication, while some classify it as out of pocket. Out of prescription. Yeah. So it basically that's why, and majorly because it's not synthesized from a chemical drug production. So yeah, it's not a drug. Yeah.
Thank you so much for that answer. Actually, the last line was where you get to the point, like how it's synthesized. And this is not a way of telling you who is listening that okay, you can make it at home and use. Please meet a physician, make sure your physician prescribes it and you're getting it from the right pharmacy, not just getting it from anywhere. Because there is also now in Nigeria and also countries outside Nigeria. Let me put it that way. Let me not anger Nigeria too much. Circulation of fake drugs. So make sure you
Yeah.
are getting the prescription from the physician and also getting from the right pharmacy. I grew up hearing about Greek water even before giving birth to children in Nigeria first. And as a parent, I've seen Greek water on different platforms, even the global north, Amazon and the rest. And if you're non-Nigerian and there is common use of Greek water in your country, you do let us know. But I don't know, maybe because I come from Nigeria and I've absorbed most of a large part of Nigerian culture, I feel we use Greek water more. But according to the tweets, like one of the tweets I read earlier in Pakistan, a mother coming for Mugo and coming with Greek water. So it seems Greek water is a global culture, not just more Nigerian and drug use. In the paper, intestinal perforation was mentioned continuously. Intestinal perforation. What is
Yeah.
intestinal perforation in simple words?
Okay. So the simplest way I would put it is intestinal perforation is when you have a hole in the intestine. Okay. So because of that hole, of course, everything in the intestine, like the foods, the bacteria that normally stay in the intestine, even the gas, they all they leak into the peritoneum, which we call basically the belly, right? And so when there is leakage into that, which is of course is not meant to be there, so the patient would have pain. They could also have serious infection. Yeah.
Thank you so much for that. On our audience getting what intestinal perforation is, and I know from the paper they were getting different types of. They are seeing different. They were coming across different names or the different parts of the intestine, the jejunum, the duodenum, the ileum, and I just want our audience to know that, let's say there are three junctions. Bus A will take you from the first part of the duodenum to the second part of the duodenum. Then the second bus, there's a junction there. Then the second bus takes you from the duodenum to the junction of the from the duodenum to the junction of the jejunum. Then the third bus stop from the jejunum to the ileum. So that's what you should know. I'm using in terms of bus stop because I feel that is how most of us can understand it. There are three bus stops. The first bus stop, the duodenum. The second bus stop, the jejunum. And the last bus stop, the ileum. So these are parts of the intestine. And in this paper, what we are concentrating on is perforation of the last part of the small intestine. It is the ileum. So back to our discussion with Dr. Kawthar. You are a Nigerian. You are grown into medic in Nigeria, and you are seeing how the healthcare system is. Do you feel Nigerian culture? Do you feel Nigerians are more excited about drug misuse with regards to condiments like Greek water? Do you feel just excited when they have children? Oh yeah, is that Greek water I'll be hearing of? Let us use it to go and buy it.
So to some extent, yes, I think so. Because I don't even think most people know the definition of colic, right? They don't even know when you say this child has colic. So the first thing is, oh, my baby is crying too much. There is no they don't have any way to know how is it abnormal or whatnot. They'll just, they're like, okay, grape water is there. Even if the parents of a child is not interested in it, or they are not so much aware of what they can use, right? There are always people around to tell them that, okay, there is grape water. Like you said, the example of that grandparent. So yeah, we are surrounded with people who don't know much about. I don't know if they don't know much about it, but I still think definitely enough there should be more education about it. And looking basically about, so from that question, even from research, you could see that more mothers, there was a research that was done in Lagos, I think in 2008. It showed that more mothers self-medicate colic, right? And they use about 43% of them use grape water. So it shows how this is a well-trusted remedy for our mothers, right? Yeah, which of course without medical consultation. Yeah.
Thank you so much for that excellent answer, Dr. Kawthar. The first episode on this platform we had was about antimicrobial resistance, and around my antimicrobial resistance, the guest research highlighted how people from low and middle income countries like Nigeria like to misuse drugs and in terms of antibiotics, and I'm trying to extend that light on how we as Nigerians and also low and middle income countries, especially countries like Nigeria, like to misuse drug, extending it to drugs like grape water because we have access to it, because we have a child or because we've acquired knowledge of utilizing it, or maybe a neighbor as a child has used it, like we just use it instead of going to the hospital, seeing a physician, and the physician examine the patient to know what is wrong with the baby. There might even be another diagnosis, but the fact that I'm a mother, and I would say, even though I've seen, I'm a mother and I'm also a medic, in as much as I've seen patients, I can tell you that when my child is to be injected, like it's another thing for me. Like you won't know that I went to medical school, you understand? I used to feel like, okay, my child is scared of injection. My first child is scared of injection. Like I used to feel like with my child until the nurses had to take him for me to hold him well, and I was not, my breathing changed. Do you understand? So so it's understandable to an extent, while mothers or parents, in fact, let me not put it as mothers because anybody can, a child is formed by two people, a male and a female. It's understandable why a parent or parents can't take their child continuous crying, continuous irritation, and they just want to suit whatever the child has. And if grief water works, it works. The very it works. It has worked for generations. But I want to talk for my own child. Other child don't have two heads. It will work for my child, and you understand. So with platforms like this, we're trying to tell people, we're not saying grape water is totally bad, but if you are to use it, make sure a physician, a doctor prescribed it. Make sure a physician first has seen your child. I'm not saying an auxiliary nurse. I'm not trying to insult anybody's profession. I'm not saying the chemist that is walking on the road. I'm not saying the auxiliary nurse on your street. I'm saying a doctor has assessed your child. I don't know why I'm emphasizing on this, because maybe because I'm a parent. It's not easy. It's not easy. You see, in the introduction, I mentioned how children from the paper, how they have hepatic failure, how they have intestinal perforation. It's not easy. I feel it's way easier to go to the hospital and see a physician and them assessing your child than for your child to end up with intestinal perforation, than for your child to end up with hepatic failure at that age, than for you to lose your child. For those who don't know what hepatic failure is liver that you eat. I don't know, some of you like putting liver in fried rice, animals liver in fried rice. The liver of a human being, the child you carried for 10 months, then because you don't want to see a physician, because you just feel you know too much, because you abuse drugs, that's why we tell you don't abuse drugs, because you feel you know, you end up using grape water. You use too much, or you don't know the prescribed dosage, you just want your child to keep quiet. And maybe because of the pain of wanting your child to keep quiet, and your child keeps quiet forever. So please, if you want to use the grape water, make sure it's prescribed. And I keep highlighting it. Please make sure it's prescribed. And yes, use it well. May God, everyone with child and want to have children, keep all the children safe. So back to our discussion, Dr. Kawthar. As a doctor, because I'm optimistic. We know we don't ask these questions. I'm optimistic someday you wish to have a child. If you have a child as a medic, yes, who has colic, because this is the common stuff. The child has colic. You are a medic, you can say, see this child as colic. If this your child has colic, what will you do as a medic?
All right.
So that others learn, okay, if my child has colic, this is what I should do.
Yeah. So, so if my child has colic, the first thing is having it at the back of my mind that this is something that would resolve as time goes on, right? I think the average of it resolving is around 3 to 4 months, and also knowing that it is self-limiting. So the first thing I always say is you start with the breastfeeding. You have to ensure that your child is latching properly on the breast. So there is no air transferred, like they don't swallow a lot of air, right? And then also if you notice, yeah, the baby is crying so much, you'd ensure that you're giving them small but more frequent feeds, right? So that's another thing, you do small, more frequent feeds. And then the go-to is upright positioning and burping after feeding, which allows them to, swallow the air, which is so many people's nightmare. Like, a mother finished breastfeeding and she's like, oh, I don't have the time to start burping. Like, oh my God, my baby's sleeping. I need to go and do other things, right? Which is your only time to do things. So people don't take their time to burp. I always, even my sisters and everyone around me, they know. I'll be like, did you burp that child? She's like, who has the time? I'm like, okay, no problem. She's like, I have so many things to do, and this is the only time I have. Like, it does not take you. Yeah, it's not something that is so easy, really, honestly. But then it's something that someone can incorporate into a lifestyle. Like, okay, when my baby is done eating, you have to there is no way, like, if you want to prevent so many scenarios or you getting so worried, you have to do that. Yeah, so it is advised to do that. Then there is a swaddling technique. You can swaddle the baby and rock. Now, I would be more concerned as a doctor if I start seeing the red flags, right? So the red flags would be if the child is not eating well, right? If the child is not eating, there is loss of weight, then those are your red flags to take this baby. You know that something else is wrong. This is not even just about colic, right? Which we do not expect in colic. So if those things are happening, those are red flags. Yeah, so poor weight gain, essentially. There's persistent vomiting, right? And the child is refusing to eat. Yeah. So in that light, I would also like to talk about what people should put at the back of their mind. So a baby just crying does not mean the baby has colic. There are so many things that should be looked into. If a baby is crying, have you changed the diapers? So many things, right? So for you to say someone has colic, these are 3 rules, right? I remember when I was in pediatrics, when you see patients, they would be like, okay, let me quickly chip in this. Also, my baby home has some cooking, sorry, I'm speaking Yoruba. Anyways, they will tell you their baby is crying,
See, the
blah, blah,
paper
blah.
was from University of Ilorin, so it's okay, that's what your
Yeah,
patients do.
those are the typical things. Anyway, so you have the 3 S's rule, which is 1, is the baby crying for more than 3 hours a day? Is the baby crying for more than 3 days in a week? Is the baby crying for more than three weeks, right? So that same pattern, and then the baby must be gaining weight. In other words, the baby must be healthy for you to say this baby has colic. Other than that, we look at other things. Yeah.
Thank you so much for that beautiful answer, Dr. Kawthar. Actually, there is a popular saying that doctors are the worst patients. And why they say doctors are the worst patients? Because we overthink everything. I have a headache, pum, 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 pum. Is it this? So actually, because I know around also pediatric surgery, where when I rotated in pediatric surgery, I saw babies with the case of gastroschisis and other cases. So gastroschisis, those that don't understand, like when you have abdominal, there's what people call the abdominal wall, a deformity with it. So when I was pregnant, for every child I used to pray, God, please, I don't want any congenital anomaly, developmental anomaly, God, please, gastroschisis, I don't want, please. So being a doctor, like we know things that can happen, and because we've seen these things firsthand, so for every step we are more careful than the normal woman being. Like we anticipate the pain because we know there will be pain there. We know what is going to happen. So usually we are usually different from the rest of the population in taking care of their family or taking care of ourselves. And I'm sure our audience, they now understand how to take care of their colic baby. If you feel the child has colic, and to reinforce again before you give, and I'll keep reinforcing because health is wealth, prevention is better than cure. Nothing can buy a life. Please see a medic, see a doctor before you abuse or misuse any medication, grape water or not, for your child. So another question for you, Dr. Kawthar, is in the paper it was highlighted that indomethacin is known to cause mesenteric vasoconstriction, while the combined prenatal and postnatal use of glucocorticoids and indomethacin has been linked to altered nitric oxide production, leading to intestinal vulnerability. So can we say, since some pediatric patients are more vulnerable than others, is grape water a complete no for such patients?
So yes, it is a complete no, because these are patients that they are at risk of intestinal injury. So the thing is to avoid grape water in neonates, in all neonates, especially now those with increased risk of intestinal injury, like the people who have been exposed to steroids, indomethacin, or even prematurity. So yeah, it's a no, especially for those ones. Generally, it is a no. Now, especially for those neonates, it's a total no. And if at all, in as much as you say what you say, people would still take grape water. That's grape water rather. And yeah, if you be taking it, just like Dr. Azeezat has been saying, they should see a medical doctor. They should be assessed, evaluated, and then reviewed, obviously, before giving their child grape water.
Thank you so much for that. Parents and parents to be and parent and current parents. I know some of you want to show. I want to show workings. People should come to my house and see. I know sometimes I'm funny, and it's the truth. Sometimes you want to show workings and you harm yourself. I want them to see that, oh, I know what all the 3 types of baby brands of soap, baby brands of cream, grape water, vitamin, this. You want to show workings. Please, in all your workings you want to show, make sure you discuss with the pediatrician. Who is a pediatrician? A pediatrician is a doctor who takes care of children. An example is who we have on board today, Dr. Kawthar. People like have pediatricians, discuss with them. I want to use this for my baby. Should I bring it on board? It's not about gathering everything and putting it on the baby wardrobe. Yes, I'm showing workings. I know what I'm doing. Yes, I have the money. Sometimes money too is a problem. When you have too much money, you spend it anyhow and buy unnecessary things. And buy unnecessary
That
things.
is
So
very true.
discuss with your pediatrician on what you should buy and what you should use for your baby before you purchase it. So next, another question, Dr. Kawthar. Some cases of perforation may even resolve spontaneously, which I feel it's beautiful, as observed in one of the cases, further obscuring the true prevalence of drug-induced complications. Please shed more light on this.
All right. So, like you said, some cases, right, of perforation may resolve spontaneously. So how does that happen? So when a baby's intestine, like I said, when you have a hole in the intestine, right, sometimes the body itself patches it up without surgery, okay? How does it do that? For example, if the hole is not big, if it's small and it's not affecting the whole intestine, right? The body has its own defense mechanism. Like, so we have the sealing, it's called the sealing mechanism, right? So a part of the intestine, which not a part, essentially a layer of the fat, right, and tissue, we call it the omentum. So it can move into that part of the hole and cover it up, right? Like a seal. So it makes a seal. So in cases like that, it would resolve spontaneously. Then we also, again, the healing methods, mechanism, and all of that. There is also proteins like the fibrins. So it can also close up that leak. Now, again, like I said, if the leak is small and there is no spread of the air from the intestine or the infection, so the baby may just improve when you do when you put the baby on nil paos, and also you have to obviously give adequate fluids and manage generally without surgery. Now, what does that mean to the research? It means that if the perforation heals without any major intervention, one, those cases like that are going to most likely be missed, right? So you would have missed clinical diagnosis. They may not even present to the hospital, because by the time they want to present, the baby is already recovering. And our people, once the baby is recovering, even the slightest sign of recovery, they're like, we're all good. So you may miss it clinically. That's the first thing. And then, of course, when you miss it, even if you don't miss it clinically, and like the child that presented to the hospital, now when we look at when you are making research and when we're doing research and all of that, and you're looking at cases, right? That cases will not be counted among the cases where surgical intervention was done. And what does this mean? It means that there would be it will not give us the actual statistics of patients that got intestinal injury or intestinal perforation, rather, due to the drug-induced or use of grip water. So it means it lowers the prevalence for us. Okay, yeah. So essentially, that's what it means.
Thank you so much for that. So I find it beautiful that it's used spontaneously. But for some parents, who have many children, they will be like, I've used this for my first child, I've used for my second child, I've used for my third child. And they didn't get anything, nothing happened to them. It might just be luck that, aside luck, it might be that they had spontaneous intestinal perforation, intestinal perforation, which means sudden, let me put it all, because I'm trying to, well, this platform is for the layman. Not everyone understands spontaneous. Nobody ever intestinal perforation. So spontaneous is sudden, when something just happens suddenly. I feel everyone understands sudden. Intestine, I mentioned earlier that there are different parts of the intestine. I used the illustration of one junction to another junction. So that is the intestine, the small intestine. The food moves from your mouth to your throat, then to your small intestine, then to your big intestine. For those who used to kill around, you see that small stuff you wash and wash and wash during Christmas or during Eid, that is the intestine. So perforation is a hole in that stuff you wash, in the stuff that the food passes through. So please, it might just be that your children, you using drip water for your children are not having anything, having any problem with it. Might be that they had sudden intestinal perforation, sudden hole, sudden intestinal healing. I mean, the hole healed on its own. So you didn't need any surgery, you didn't need any complex medical follow-up. So that does not mean if you have many children, if it works for one child, that does not mean if drip water didn't have any adverse effect on one child, does not mean it might not have on the next child. Children are different. Even pregnancies are different. So please, I'll keep reinforcing it. This is platforms like this we used to advocate for antimicrobial, for drug use, whether antimicrobial or or non-antimicrobial like drip water. Please don't use drugs that are not prescribed. Don't use drugs except they're used by the physician. Buy drugs from the right outlets, because not just in Nigeria, across the world, fake drugs are increasing everywhere. So lastly, Dr. Kawthar, you've discussed extensively on this publication with beautiful answers, and I'm sure our audience are impressed. what advice do you have for people like me, for current, because I'm not a parent, for current and future parents on use of grip water?
Okay. So the advice for current and future parents is have it at the back of your mind, please, that grip water is not recommended as the first line for colic. Like we have talked extensively about things you can do. I didn't mention grip water. Yeah, so it is not a first liner for management of colic. And this is essentially because of the lack of proven benefit. Yes, people would say it works, and they strongly believe that it works because generations to generations have used it, and they didn't have any adverse effects. But is it really worth it if the child actually develops the adverse effect? It could actually be just that one child that would get the adverse effect, right? So yeah, and then parents should also focus on all the non-pharmacological soothing techniques. You should always go to doctors. The hospitals are open, really. There is no way someone would tell me, because Nigerians, we like moving to the pharmacies. I mean, I'm not throwing shades, but yeah, we like going to pharmacies. You just find someone who maybe has like 3 or 5 kids, and for you, it's your first child. So now, if you need any information, again, it's not about picking up your phone and making, searching on Google, searching on ChatGPT to see what you have to filter. And that's a difference between a layman and a medical doctor, or whoever a practitioner you're seeing. They know what to filter, because these are things they've been studying. These are people that have come across so many cases that they are shaped. It has shaped their experience and their knowledge and clinical skills. So you need to obviously see a medical doctor if you think it's getting out of hand, and you think there is any red flag, like I mentioned earlier. You should see a doctor. Avoid grip water. Now, if you decide to take grip water, take it with precautions. There are those on the grip water, they write the what quantity should be taken. Don't decide that, oh, it can only get better if I add a little bit more. Just a little bit more can actually cause more damage. So if you choose to use it according to the prescribed dosage. No, I mean, it's not a drug, but yeah, the prescribed quantity and all of that. Yeah. Over
Thank
to
you so
you.
much for discussing extensively on that. Actually, you mentioned non-pharmacological management of colic, and I feel that is what more parents should dwell on before even going to using medications such as grip water. And I'm someone who is religious. I will tell you, some people say listen to white noise, put white noise, suit them, shower the baby, make sure they are comfortable, play the white noise. For someone who is religious like me, I would say play the word of God. For someone like me, play Quran. If you're a Christian, put the word of God, the Bible, or audio Bible, let them listen to anything that you feel will suit the baby. And I'm telling you, it works. Aside, that's why actually I don't know. I don't maybe because, as I said, doctors are the worst patients. I don't use drugs for my babies. I don't know, because their system is still very delicate. So when you know these things, you won't go overboard. So try to use non-pharmacological management of colic before you move to. And I feel knowledge is power. People do what they know, because grip water has been passed from one generation to another. The first thought that comes when they feel, okay, this baby is crying, is to give grip water. I feel we should also pass it, if we are listening to this, also pass it from one generation to another, that there is non-pharmacological management of colic. So with this, we've come to the end of this episode of Dr. Fajembola'S opinion. I'm so grateful. We are so grateful, because I'm not the only one listening to this. We are so grateful to have Dr. Kawthar Omolola Ahmed on board. who beautifully explained everything we need to know about colic and its management. And I encourage you to read the paper. The paper will focus on it on the weekly read. So please access the paper and read this paper, because it's not cartoon, it's not AI, it's real life. These are real life happenings that happen in the hospital, real life babies, real life patients, real life hepatic liver problems from reporters. So you see what is happening. I pray it doesn't happen to you, and I pray it doesn't happen to anyone close to you. And how we do this is through advocacy, through speaking and speaking, through listening to platforms like this, through doing the right thing. So yes, my mantra is each one help one. Share the paper, which is an author on grape water and Nospamin use. And I wish everyone a healthier week, a healthier month, and a healthier year. Bye for now.